Hi, everybody. Welcome to another episode of our GenoCare podcast. Today, I'm in the driver's seat. It's Ali here, and I'm interviewing our wonderful credentialed mental health nurse, Emma, who has joined us right from the beginning to help us establish GenoCare and provide some really wonderful psychosocial support to people navigating genetic testing around pregnancy. Welcome, Emma. I guess to start, do you want to just tell us a little bit about yourself?
Yeah, thank you. Hi. So, yes, my background is as a mental health nurse. Before that, it feels like a lifetime ago, I used to be a midwife. And then I switched into working in perinatal mental health because through my professional experience and my personal experience, I just saw there's such a lack of support, like across the board. And so when I heard about what you were doing with GenoCare, I thought, oh my goodness, that's an area that, again, I'm not surprised, but also am about how there's not that mental health support in this particular area. And because I work a lot with birth trauma as well, I feel like understanding the trauma responses from receiving some really awful news as well. I feel like have a really unique skill and experiences that I all think lend really well to working within a service.
So, how do you see the role of a mental health nurse or a counsellor in providing support around genetic testing? So, obviously, you guys are not genetic counsellors, that's a separate profession. But where do you see your role as fitting into the process that people go through when they're having and experiencing receiving genetic testing results?
I feel like for some women, it's like bomb has gone off in their world and their whole reality, they might feel destabilized during the process if they receive particularly really bad news, but even just some really disturbing, unsettling news. I feel like we're the safety net to catch them underneath that, where we have been given really comprehensive genetics screening. So you don't have to come and explain what it is that you have, whatever news that you have received. I think that's a really key piece because if going to find other mental health support, having to explain and educate the person who's going to support you about what it is, that can be just mentally taxing. And again, that can be traumatic as well. So you don't have to explain what it is in more than a few words. And we understand the response. If you might have had a response, a nervous system, fight or flight, or anything like that, we'll be able to help unpack any of that, but also just be that safe place to land for you to process and say the big, scary thoughts that you don't know where to say anywhere else because you might not have someone else that you can speak these things out loud to be that safe place. If you need to go into that future projection and talk it through, then we're there for that. Whatever it is that you need to help you and scaffold you through the experience, whether maybe you don't have many coping mechanisms and you don't know how to process this information to get through on a daily basis. So we can offer you some coping strategies and work through what works for you as well. And just help parcel out what it is that you need to help just whilst you go through this experience. So it can be almost whatever it is that you need, but it's just that safe place to be that as well. And also just validating your experience and how awful it is because not everyone has that in their life, unfortunately. So it's just that safe place. It's how I see it, which feels like it's a bit all over the place, but I feel like we do go all over the place wherever it's needed.
So it's tailored to whatever the presenting need is in front of you. In my experience, I often see that genetic testing can be the first step where people encounter a hurdle in terms of embarking on having a family. And for many people, their lives have been fairly straightforward up until that point.
Mhm.
So often I observe that a genetic testing result that's unexpected can really feel very significant to people, but also they may not have the coping mechanisms to be able to manage it because they've never been through anything particularly difficult before. and this happens to a lot of people, is, when we think about embarking on starting a family, it's a really exciting time. People often embark on genetic testing and think, I'll do that test. My friends have done it. My doctor recommended it. I want to tick off all the boxes that I should in terms of planning for a pregnancy or an early pregnancy to make sure that everything's going to be okay. That's often how people will phrase it. And people are not expecting something to come from that testing. And so when it does, it can really rock people to the core. And I think that's why it's so wonderful that you guys are here to be able to provide that additional support, because often as a genetic counsellor, we might see someone once or twice, and we might explain to them what the result means and explore how they're coping at that point in time. We might help them navigate additional testing and explore how they're coping. But sometimes people need time to process it. And some of the questions that come up might not necessarily come up in that time frame where they're seeing a genetic counsellor. So having that additional psychosocial support as the information ripples through their lives can be really, really helpful.
Yeah. And particularly if you are at the start of your journey, you might have a few different appointments and different people to see, to have that touch point in between each appointment, just to help bring some grounding, or to debrief the experience as it's going as well, I think could be really helpful.
So tell me a bit more about being a mental health nurse and what's involved in being a mental health nurse. So what types of skills do mental health nurses have, and what types of work do they do?
So we, particularly working within the field of perinatal mental health, really work with the feelings and emotions and the process of, being a mental health nurse, and really I can only speak from experience of being a perinatal mental health nurse. I haven't worked in the field of mental health as a whole. So my focus is specifically on the perinatal experience, which I think is different from any other mental health experience. Because when you're talking about perinatal mental health, you're not just talking about the mother. There's a baby, an infant, a pregnancy involved. And that adds a layer of extra consideration and extra complexity, because the emotions are so entangled within that as well. And there's extra layers, the processes that you're going through. Even if it's pregnancy, it's extra taxing on the body. There's neurological changes that you're going through. Your brain's being rewired during pregnancy. And this can add to the emotional experience. And then you add on top unexpected results, a destabilising experience where you feel like your core has been rocked. That just adds an extra layer of complexity and consideration, where we would take the approach of the person first. So not coming from a background in psychology or counselling where we might think diagnosis first. We don't have that approach. It's a woman-centered approach. What is it that you need? What is it that you're going through that we can help you? So having the background of nursing means that we can look at the social support. Who's in your network? Who can we talk about? How do we build network? We're really good at being able to support with that. How do we look at your physical health as well? What might be contributing to your distress that you're going through? If your body's been through something as well, we need to look at, are there contributing factors to making you feel even more destabilized? Like things to consider, that potentially maybe look at some blood screening, or this is another avenue to help support your physical self, which will then help support your mental health self, because they're not separate. Like your physical well-being and your mental health well-being are so deeply intertwined. So I think that's one of the strengths of the mental health nurse, is that we're a women-centered approach of what do you need in this moment. And we're really good at adapting and adjusting to that as it goes along, because it might be that first we need to talk about this, but then over there we can talk about that. Something completely different, but also related, and sort of jump between. And that's just what we're used to with our nursing background as well. So, yeah.
And the mental health nurses that I have met have all done quite extensive training in therapeutic approaches that also align with counselling. I wondered if you want to comment on those as well.
Yeah. So to become a credentialed mental health nurse, we have to have done extra study within the field of mental health. So that comes with that basic counselling training skills. So we do have those. And then we can go on to learn further modalities.
Mm-hmm.
So I've learned eye movement desensitization and reprocessing, which is a trauma treatment modality to help work with the physiological impact of trauma and the emotional impact that it's left behind. But it gives a really nice overview of the impact of trauma and coping strategies to help as you go along to help you get through this process. And then also acceptance and commitment therapy training are the two modalities that I draw upon a lot, which is just a modality on, I think the name acceptance gives it a bit of a false flag because we're not just accepting our situation. It's more accepting the impact that it has and not trying to fight the feelings that are coming up and trying to be, and that kind of creates an internal war if you're trying to suppress all of these bad emotions because for whatever reason it may be. There are many reasons that we might do that. But learn to work with them so that we're all still in alignment with ourselves and not fighting this internal conflict. And there is a multitude of strategies that we use within ACT as the acronym there, just to help as we go through whatever the situation is. They're my two main ones, but also I have some specific perinatal training as well. And birth trauma is one of them. And then also matrescence, and that's the name for the transition you go through as you become a mother, which plays a part starting in pregnancy as well. So I feel like that's always very relevant no matter what I do.
We should do a whole separate podcast recording on that, so stay tuned. It's really interesting to think about it in that context because genetic testing often comes in right at the beginning of that transition to motherhood and parenthood. And so, yes, we should talk about it again because I think it provides interesting food for thought about how genetic testing can influence that process and the timing of it and some of the things that we should consider.
Yes, you touched on it before, but talking about something that society as a whole generally perceives pregnancy is this exciting thing that a couple could go along or a woman could do is being pregnant. And it's usually something that's celebrated. And when something happens that might take that excitement away, and there's a real level of grief that comes with that as well. So I think that's something that's, a part of that piece as well is acknowledging that grief and all of the feelings that come with that.
So pulling together everything you've just said, maybe to create a picture of the role of mental health nurses in providing this support, it sounds like what you're saying is it's really taking some of the physiological considerations and some of the psychological considerations and some of the social considerations and being able to look at which of those elements people needing help in navigating and being able to provide that. And usually with genetic testing results, there's always big emotions. And so you guys have that expertise in helping people navigate those emotions. And in some situations, like we were saying earlier, where it's often the first time that people have navigated something complex, actually teaching people how to cope with big emotions and how to navigate that.
Yes. Yeah, absolutely.
Well, it's awesome to have you on the team. And thanks for giving us a little bit of an insight. And I think we'll definitely explore some of the topics that you've just touched on in more detail in future episodes.